And so welcome to today's 1-hour webinar supported by Prevention Plus Wellness LLC, located here in beautiful St. Augustine, Florida. My name is Dr. Chudley Wirch, and I'm president and founder at Prevention Plus Wellness. Today is a sold-out session. Some of you are watching this live. Some of you will be watching it recorded. Regardless, if you have any questions at the end of today's session, feel free to send them to us. You can do that in a couple of ways. Our email address is info at preventionpluswellness.com, or just go to our website, preventionpluswellness.com, and in the lower right-hand corner, you'll see a message us, and you can just click on that and send us a message. So if you have any questions, we will be having a little Q&A at the end of today's session. But if you're viewing this a recorded session, remember you can always contact us from our website, preventionpluswellness.com. So today's session is one session alcohol. Vaping, that's vaping e-cigarettes, marijuana, opioid use prevention. And this is an introduction to Prevention Plus Wellness program. Sometimes we call this is the core knowledge, if you will. So if you were to be trained as a program implementer in any of our programs, this would be part of that training session. So let's take a look and see what we're going to be covering. We've got a lot of slides, a lot of content. If you've taken in some of our webinars in the past, there'll be some overlap of some of that content, I'm sure, but also some new stuff. And again, for those of you being trained as program implementers, this is really essential information to understand what Prevention Plus Wellness is all about. So there's 4 objectives for today's session. The first is to examine the alcohol, vaping, marijuana, and opioid PPW programs. That's Prevention Plus Wellness programs. They are screening and brief interventions, SBIs. So we'll discuss all that today. Secondly, we're going to compare and contrast the differences between typical substance use prevention programs and PPW programs. There's quite a bit of difference. And I think it's important to understand those differences, which are actually advantages of the Prevention Plus Wellness programs. Thirdly, we're going to explore theory and research which supports both brief interventions, screening and brief interventions, as well as multi-health or integrated health behavior interventions. And then lastly, we're going to look at options, settings, adaptations for implementing and evaluating Prevention Plus Wellness programs. So here we go. Let's take a look, first of all, at Prevention Plus Wellness programs and their components. I think are without a doubt our most popular program implemented in all 50 states and other nations is the Sport Evidence-Based Prevention Plus Wellness program. The focus of sport is on alcohol primarily, alcohol prevention. This is evidence-based program, been evaluated, found to be effective in preventing alcohol as well as tobacco and cannabis for general populations as well as substance using populations, as well as increasing physical activity. And the targets, as you can see there under number 2, are alcohol and drugs, but also promotion of physical activity, healthy breakfast and nutrition, sleep, and to a certain extent, stress control. This is, like all but one of our programs, a single session screening brief intervention. It can be implemented in, I'd say about 45 minutes or so, depending on how much time you want for interaction. It is a screening brief intervention. We have high school, middle school, and elementary school versions. It's implemented with a set of PowerPoint slides. We have in the physical manual that you receive scripts to implement your program to youth, either individually or in a group. Of course, now we have online protocols to provide your program remotely in several different formats, one-on-one, in a group, hybrid fashion, that is in person, while also streaming live, as well as by video and telephone, all that in our digital downloads, I should say our COVID-19 protocols on our website. All programs at Prevention Plus Wellness are based on the behavior image model. We'll be talking more about that today. It's a positive image marketing related model. Sport also includes parent materials, completely separate intervention included in the sport programs. And along with your physical manual, you also receive a digital download of the slides and all reproducible material. So if you do happen to purchase the sport program, you don't have to purchase anything beyond that because you make copies and you can implement your program to countless youth. So no need to come back and purchase additional materials. Our parallel program to sport is called InShape Prevention Plus Wellness. This program is for young adults. It's being implemented to college students, young adults in community settings, even in the military, and found to be, because it's evidence-based, found to be effective in preventing alcohol, cannabis, drinking, driving, increasing physical activity, and other health-related quality of life measures. Targets alcohol and tobacco, as well as physical activity, both moderate and vigorous physical activity, healthy eating, sleep, and stress control. It's a single session screening and brief intervention implemented with slides, also based on the behavior image model, that marketing positive image conceptual model. And again, you get a physical manual, you get your reproducible materials, and there are online protocols so that you can implement InShape remotely. Then these are our, what we call evidence-informed programs. All of these, keep in mind, as well as all of Prevention Plus Wellness programs, use an evidence-based practices screening and brief intervention format. But these programs, starting with vaping, which is our e-cigarette prevention program, have not been thoroughly evaluated. But again, they do use an evidence-based practices screening brief intervention format. Obviously, vaping PPW focuses on targets substance use, targets e-cigarette use. And because it is a modification or an adaptation of sport, it also addresses healthy eating, nutrition, physical activity, and stress control. There are versions for high school, middle school, elementary school, and the same with our other previous programs, Sport and InShape. You get a physical manual, you get a digital download, and you can implement this program individually or in a group, in person or online. And so it's a program if you want to address specifically messages to youth about how vaping, e-cigarettes, interferes with healthy lifestyles, and particularly how it interferes with achieving and being more physically active, fit, healthy by harming physical activity, nutrition, sleep, etc. So that's the vaping PPW program, marijuana PPW program, same thing, adaptation of the sport, Prevention Plus Wellness program, screening, brief intervention, but it addresses marijuana and promotes protective wellness behaviors. High school, middle school, elementary school versions of this program, manual and digital download. That's the marijuana PPW program. Opioid PPW is actually a little bit more like the InShape program, has a little bit more content on stress management because we felt that that was critical to opioid prevention. There's 3 versions of this program as well, adolescents, but also 2 other high-risk groups, young women, young childbearing age women, and young men, particularly blue-collar men. And so those are the 3 versions, adolescents and then high-risk young men and women. Again, screening, brief intervention, single session, opioid prevention plus wellness program. And lastly, we've got some others. I'm just going to group them here on one slide. We've got our only multi-session program, Sport 2 PPW, high school, middle school, elementary school. This is the only program where we actually sort of dissect or extract each of the wellness behaviors and have separate lessons. So we have a separate lesson on 3 different types of physical activity, 2 different types of nutrition, a separate lesson on stress control. That's the Sport PPW program. In God's Image is our faith-based program for youth. Similar thing, it addresses substance use avoidance. It addresses healthy behaviors like nutrition, sleep, exercise. But the difference within God's Image is that it does also promote spiritual practices. So it's great and a nice fit for for faith-based settings. And lastly, our newest program, Racial Justice, PPW, addresses, and this is the most unique program or different program we have because it addresses substance use indirectly. We do know through research that racial discrimination increases substance use, depression, school failure, other things among adolescents. So we're addressing it indirectly. In other words, racial discrimination or racism is a social environmental risk factor for substance use among youth. So what we do in Racial Justice PPW is address racial justice behaviors or positive anti-racism behaviors, and we promote those among youth while avoiding racial discrimination. Great program, Racial Justice PPW. Now, let's compare and contrast, if you will, typical substance use prevention programs in the left-hand column with those prevention plus wellness programs in the right-hand column. So in the left-hand column, typical substance use prevention programs will address one or sometimes more substance use behaviors. They are typically multiple sessions. They could be 6, 10, 15, or even multiple years. They're largely educational in nature, and they address substance use risks, and the good ones address resistance skills. In the right-hand column, by comparison, prevention plus wellness programs address substance use risks, but also chronic disease risk behaviors. That is physical inactivity, screen time, not eating breakfast, poor nutrition, lack of sleep, lack of stress control. And prevention plus wellness programs are a single section, most of them are, a single session allowing them to be very practical, very feasible, and allowed to be implemented in just about any setting, even the most busy settings. And they are motivational in nature rather than educational. Motivational, screening, brief intervention. They have real intention behind prevention plus wellness programs and all screening, brief intervention is to start the process and to maintain the process of behavioral change. With prevention plus wellness programs, that includes avoiding substance use and promoting and engaging in one or more protective wellness behaviors. Number 4, PPW programs address substance use risks like typical prevention programs, but also the focus is on self-control skills, which is so desperately needed among young people, particularly high-risk young people, and the focus on desired future images, which increases motivation for change. From there, we can go on to number 5. PPW programs promote habits that improve both physical and mental health. I'll talk more about that. Emphasis on multi-behavior goal setting, as I said, not just avoiding substance use, but integrating that with the promotion of protective wellness habits, physical activity, sports, nutrition, breakfast, sleep, etc. Number 7, PPW programs are scripted. That increases fidelity, ease of use. It reduces time for training. Number 8, we promote tailoring. So if you feel you need to tailor your program, we work with you hand in hand to ensure that your prevention plus wellness program, and this is all discussed in our 2-hour online program implementer training. So if you get training, we will encourage you to tailor if you feel that your population or your setting is unique. And so we could show you and help you with that. And it's a collaborative venture between you and your organization and us, just as long, and we help ensure that the model, the underlying conceptual and practices model are not breached, and so that you have the greatest chances of efficacy. 9, optional remote online implementation programs. Protocols are now available so you can implement your program remotely during the pandemic. And lastly, we have built-in pre-post surveys to allow you to assess your program's immediate effects, not like some epidemiologic survey that's done every year that sort of might not capture what your effectiveness is of your programming. But this pre-post of your particular lesson will give you as an instructor, as a prevention specialist in your organization, feedback on how well your prevention plus wellness program is working for you. That gives you the power of the data to promote your program and to improve it over time. All right, so let's now dig in a little bit more. Excuse me, I am so sorry about that. I hope I didn't blow your ears out. I don't know where that came from, but now let's dig a little deeper into the content I just shared with you, the differences between prevention plus wellness programs, the unique aspects of them, which are advantages, and starting with the fact that PBW programs address not just substance use, but chronic disease risk behavior. So here we're seeing what's addressed in the, I think, the high school versions of our programs. And so you could see that PBW programs address alcohol and other substance use, obesity, screen time, physical inactivity. You can go down the list, you know, unhealthy eating, lack of sleep, uncontrolled stress, other risks. And it does that by really addressing the flip side. So for example, unhealthy eating is addressed by promoting healthy breakfast and healthy nutrition, particularly fruits and vegetables. So this is how prevention plus wellness programs address these chronic disease risks. Those are all chronic disease risks, you know, whether it's obesity, environmental influences, unhealthy eating, lack of sleep, etc. Alcohol and drug use is also addressed by promoting avoidance or reduction of those risk behaviors. And even under number 7, with our unique programs in God's image, racial justice, we even address some other risk factors for substance use. So that's how we integrate substance use and chronic disease risks. Prevention plus wellness programs are screening and brief interventions. Here, the 3-step process for that. Step number 1, all of our programs follow this practice. You screen youth for the current health habits using a screening survey. It could be online, it could be in person. This increases awareness of their health habits, very important, not just substance use, but the wellness behaviors. Secondly, you then turn around and provide feedback on each of those behaviors. And what you're going to do is you're going to use positive image messages from the behavior image model and a PowerPoint slides. And this is going to increase motivation for change because you're going to use positive image terms like fit and active, successful. That's going to cue or trigger desired images of themselves, of the youth, of themselves in the future, desired motivational images of themselves or their peers. And then, of course, obviously how substance use is a barrier or harms that. That will give them understanding of how behaviors interact with each other, diverse behaviors interact and support or harm each other. And that will increase motivation for change. And then step 3 of this 3-step process, screening, feedback, goal setting, is goal setting, and not just to avoid substance use, but to increase protective wellness behaviors. And this is a step toward increasing self-control or self-regulation skills. And so very brief 7-day goal setting to move youth in the right direction to start shaping their own behaviors and teaching self-regulation skills. So that's the 3-step process. So let's take a look at evidence that supports this screening and brief intervention, like the 3-step process that Prevention Plus Wellness uses. If you look in the left-hand block, you'll see that there was an excellent review of research. That's numbers of studies, not just one study, done in 2015 by Tanner Smith and others, and Lipsey. And this was a great review, which highlighted the fact that screening brief interventions can be effective for adolescents and young adults up to a year after receiving that brief intervention. This study also found out that brief interventions that had goal setting, like Prevention Plus Wellness programs, were particularly effective. Now, as we go along through this, I see some hands being raised. Love to address those questions. Write them in the chat space and we'll take a look at them. Or if you're listening to this in a recorded session, you can email us your questions and we'll be happy to address them at info@preventionpluswellness.com. Okay, in the right-hand block, you'll see that we also conducted some studies of Prevention Plus Wellness programs showing effects even a year after the initial intervention. That gives you a little bit of a sense of the effectiveness of screening and brief interventions for adolescents and young adults. Keep in mind, screening and brief interventions in general are supported as evidence-based practices by a number of federal and international organizations, including SAMHSA, the Substance Abuse Mental Health Services Administration, has identified brief interventions as evidence-based practice. In fact, they came up with their own model for evidence-based screening and brief intervention. Is called SBIRT. I'm sure many of you are aware of that: screening, brief intervention, and referral to treatment. The CDC, Centers for Disease Control and Prevention, also supports alcohol screening and brief interventions in primary care settings. The World Health Organization supports alcohol screening and brief interventions. Continuing along, the National Institute on Alcohol Abuse and Alcoholism supports alcohol screening and brief intervention for youth. The American Academy of Pediatrics supports screening, brief intervention, referral to treatment for youth. And the National Institute on Drug Abuse supports adolescent substance use screening for screening and brief intervention. So you get all those organizations, evidence-based organizations that support screening, brief intervention as evidence-based practice. But let's take a look at evidence supporting prevention plus wellness as a screening and brief intervention. So we have two evidence-based programs. In other words, programs that have been rigorously evaluated under controlled settings. The results have been published in scientific refereed publications. And then and only then have they been placed in evidence-based registries, a whole bunch of them. I'll show you a list in a minute. But let's take a look at, rather than InShape, let's take a look at sport evidence. And this is, again, peer refereed published research in these 4 journals. And this page here just shows you a summary of the outcomes across those published findings. That the single session sport prevention plus wellness program significantly decreased alcohol use initiation, quantity, frequency, binge drinking, and alcohol problems among young people, while increasing physical activity. It also reduced cigarette smoking up to a year after the intervention. It also reduced binge drinking, smoking, marijuana use, and increased physical activity among substance using youth even a year after the program. And in fact, some of the effect sizes were large among substance using youth, which suggests the use of prevention plus wellness programs like sport as a universal prevention intervention, as well as selective or indicated intervention. Increased parent-youth communication was found among published results. And we did one study of 3 of our 4 parent flyers, which come with the sport program. And those flyers were found to reduce alcohol use problems, marijuana use, and increase parent-youth communication with those flyers, which is that additional component of the sport PPW program, that parent piece. Lastly, sport was translated into Turkish language, and there was a controlled study in Istanbul which showed that adolescents who were exposed to sport compared to those who weren't improved indices of physical activity, nutrition, sleep, and mental health. So a broad range of effects from the sport program. We also regularly, in our post-test surveys, have open-ended items. And when you have those open-ended items, you could capture what you say about receiving the sport program. And here, these 6 items give you a sense of what youth think about the program. So it's a great wide range of reactions and testimonials, if you will, about what they liked and what they thought was effective. From number 1, talking about how it impacted their alcohol and drug use, to improving fitness goals, to improving nutrition, to number 4, improving their body image, and even number 6, that it was just fun. So good feedback from the youth in their own words that you can use to promote your program and to know that you're having a significant impact on young people. So these are the published papers. You could read more on our website, preventionpluswellness.com. You could read more about the effects of sport and InShape. Sport and InShape are listed on a whole number of a variety of evidence-based registries, blueprints for healthy youth development, NREP, the now defunct NREP, results of first clearinghouse database, etc. So, okay, let me move on. Prevention plus wellness. It targets substance use risk and self-control skills. Now, how did we come up with that? We came up with that by the use of the behavior image model. This is a conceptual framework for all prevention plus wellness programs, the BIM, the behavior image model. It's marketing related, and it's a theoretical roadmap that integrates the promotion of wellness behaviors that helps you address the chronic disease risk while preventing substance use. Now, there's two components to the behavior image model. The first is the assumption that you can use positive image to increase motivation for change. And number two, that you can use behavior goal setting, multiple behavior goal setting, to increase youth self-control. So let's take a look at this a little bit more. This model, these two parts of this model. First of all, positive images. Well, actually, before positive images, let me just talk about substance use risks that are addressed in prevention plus wellness programs. So the unique aspect of PPW programs is addressing that first item on that very first block, where the content addresses how substance use is a barrier to and harms each of the targeted wellness behaviors, whether it's physical activity of different kinds or sports, breakfast or nutrition, sleep or stress control. That's a core message that usually increases perceived harmfulness of substance use. But then you can go down this list and see that other risks are addressed in PPW programs, such as the notion that substance use, whatever program you're using, and whether it's addressing alcohol or e-cigarettes, marijuana, opioids, tobacco, etc., whether these substances, that's the fact that these substances do harm your fitness and health and cause life problems. Then myths are addressed in our prevention plus wellness programs. The social norm message that most youth do not use. Healthy alternatives are presented all the way down to the bottom. Recommendations for wellness, living a wellness lifestyle. These are the typical substance use risks and content addressed in prevention plus wellness programs. So it goes beyond the messages of substance use as a barrier to wellness behaviors and addresses multiple risks. Some of these risks are obviously addressed in other substance use prevention programs. Now, let me show you some examples of this so you get a really better feel for what I'm talking about. So we're going to go through some of our programs. We're going to start here with the sport. Remember, sport addresses alcohol primarily. This is the high school version. So you can see how these messages are laid out, even with the images. So here you see the content. Active life and alcohol don't mix. In fact, alcohol and drugs hurts relationships, how well you do in sports, feel about yourself, energy level, etc. So that's the content. You can see how it compares or contrasts, and shows that substance use, alcohol in this case, barrier to these positive images and positive outcomes, in this case related to physical activity. And then we have this a very positive image of a young person kicking a soccer ball. So you see that we're showing representations of young people engaged in wellness behaviors. So this is the kind of content you'll see. This slide, again, while this one addresses physical activity, the second slide addresses nutrition. Alcohol, marijuana robs your body of vitamins and minerals, leads to weight gain, saps your energy needed for sports, physical activities, life. Great messages, great content, showing the barriers, in this case, to nutrition and nutritional outcomes in the human body. And there's a great image of young people, happy, healthy, eating nutritiously, and this is the high school version of sport. Here's one addressing sleep. Alcohol, tobacco, drugs disrupt sound sleep and stop deep sleep patterns. Why is that important? Because it's important to maintain an active, high energy life. So you can see we're comparing it to those positive images, active and high energy, and those really cue desired future images of young people. And here's a generic risk message about how alcohol, drugs put you at risk for life problems, embarrassing yourself in front of friends. That's a very salient issue for young people, getting hurt, getting sick, getting in trouble, etc. Now let's take a look at, we can compare that sport PPW program for high school. Let's look at the vaping PPW program. That's e-cigarette messages. And this is elementary school version. So you can compare the differences. One of the differences you notice right away, the beautiful young people here, you're showing children because it's elementary school, happy, healthy running. And this is a great positive message, key to being fit and healthy mind and body, lots of physical activity, and staying away from e-cigarettes as well as regular cigarettes. Here's a message about nutrition. Again, beautiful images of young people eating healthy. E-cigarettes use candy and fruit flavors, appealing to youth. Vaping can reduce the body's use of vitamins and minerals. Withdrawal symptoms can make it hard to eat healthy and be active. You may need to give a little instruction about what that meant, withdrawal. But nonetheless, you're seeing the effects of e-cigarettes on eating and being healthy. Great picture here of kids happy, healthy, great colors. And you got two important messages here. You've got the social norm message that most kids do not use e-cigarettes, and then another message about how they can improve their social skills to say no to using an e-cigarette by practicing, like any sport or skill. And then lastly, very great message here to keep healthy, brain and body, have more energy, look and feel good, all those positive outcomes and images, do better in school and sports, stay away from all e-cigarettes. Here's a sample of the marijuana PPW program. This is the middle school version. Here you got middle school on a bike. You've got active life and marijuana don't mix. Marijuana can hurt your brain, lungs, as well as how well you do in school and sports. So that's a physical activity message. Here's a nutrition message. Marijuana leads to junk foods, weight gain, saps your drive to do well, spend time with family, friends. Withdrawal symptoms make it hard to eat healthy. Great content, great images of middle school youth. And again, most of these images are very positive, and really you're modeling these positive behaviors of eating nutritiously. Here's a great message about sleep. And it's sort of a message indirectly. So we're talking about how sleep is essential and to certain things, and how marijuana affects those other things. Like marijuana harms your ability to think clearly, leading to lower grades, where sleep improves that. Cannabis is linked to increased depression, anxiety, drains your energy needed to live actively, and that's what sleep is all about. So that's how we link marijuana to sleep. And here's again a generic message about just life problems associated with marijuana, sort of framed a different way. By not using marijuana, you'll not experience these negative outcomes, getting into trouble with friends or parents, harming your brain, ability to learn, grades, lungs, physical fitness, etc. Now let's look at an example of the opioid PPW program. This is the adolescent version. We also have a high-risk young men and women version. You could see great content here, a little bit more content in the opioid PPW program, great positive images of young people, healthy, happy. Non-medical opioid use interferes with creating a physically active lifestyle. How? In those 5 particular ways: drowsiness, mental fog, nausea, constipation, decreased energy level, poor coordination. Great content. Here's one about opioids interfering with nutrition. Great positive image illustration there, but talking about how opioids can cause nausea, constipation, and you just can't eat healthy when you don't feel well. And there's some other great content there about how opioids really makes it very difficult to live a healthy life and eat healthy food. Non-medical opioid use can aggravate and cause stressful life events. And so here's the linkage between opioid use and interfering with stress relaxation and a peaceful, tranquil kind of a lifestyle, which we all want. Then there's some extra content requested by Substance Abuse Mental Health Services Administration, SAMHSA. They wanted some instruction in all of their opioid prevention programs that address medication-assisted treatment, or MAT. So that's in there. And so that's why there's some extra good content addressing that in all zone. In addition to that content, in addition to the positive images, Prevention Plus Wellness programs focus, because they're on the behavior image model, that second part of the behavior image model, first part being positive image, second part being multiple goal setting. This is increases self-control. How does it do that? Self-regulation skills are learned to set and monitor behavior goals. And the more they do that, the more self-regulation, self-control they learn. It's a two-step process: avoidance of a substance or substances, alcohol, e-cigarettes, marijuana, opioids, whatever. And nextly, improvement of one or more protective wellness behaviors, always trying to include a public contract, assigning, making it a public document, and research shows that increases motivation for change. So that's the process of improving self-control and prevention plus wellness programs. You could learn more about how the prevention plus wellness screening brief interventions work by going to our website, preventionpluswellness.com, and you can see the logic model that we have on our website. Let's take a look at prevention plus wellness and how it addresses peer and desired future images and the effectiveness of that. So why do we believe positive images, let's say more than any images, or negative images are more effective or are effective? Three sources of evidence. Number one, conceptual or theoretical. Number two, research. And number three, practice. And you can see under the heading of conceptual, there's a whole number of behavioral theories. I think one of the best is possible selves theory, that shows that young people do think about a future self and a desired self and a feared self, and those drive decisions, including health decisions. But so do others, behavioral theories like Bandur's social theory, etc. Secondly, plenty of research supports the use of image, and particularly positive image, and influencing decisions that young people make about their health. All you have to do is look it up in the areas of self-concept, prototype images, possible selves, and positive identity. All of these areas, you'll see research supporting the use of images in communications to influence the youth decision-making. Thirdly, decades of practical experience and use supporting positive images to influence human behavior, young people's behavior, adult behavior, and that's been done in marketing and advertising in the world's largest companies for decades. So you can see one example to the right. Are we having blank yet? And so you could fill in the blank there, whatever you think that is, fun or Bud Light or whatever. But notice the images there: happy, healthy, socializing. And these positive images, these appealing images of young people, have been used to sell everything from cars to clothing. And you could also use these images, according to theory and according to research, and according to, I think at this point, even practice, to promote wellness lifestyles, to avoid substance use and promote healthy lifestyles. You don't have to sell something. You could sell a healthy lifestyle by using positive images and behaviors. Last point, number 4, about positive behaviors. Anecdotal evidence we found is that positive wellness habits, the focus on those in prevention plus wellness programs, make PPW programs much more acceptable and interesting to youth, to families, to organizations, to funding agencies, because of this integrated aspect and the focus on positive behaviors, that being, again, nutrition and wellness and sleep and stress control. Because I'm sure many of you know and have experienced this, especially when youth get to an older age, old adolescents, young adults especially, they've heard the risk messages and they sort of tune those out. So linking substance use prevention message with positive behavior messages is a good strategy for prevention. How does this happen? How do we construct these integrated multiple behavior messages using images? How do we link substance use prevention with the promotion of wellness? The goal of this kind of communication, the goal of this kind of programming or messaging, is to trigger a mental image of a healthy behavior and substance use as counterproductive. And you do this by using positive image terms and illustrations. Illustration is to the right there. You can see very happy, healthy, good-looking young people. So it's a two-step messaging process. Step number 1, you present positive desired images, future and peer images, and other benefits of a particular healthy habit. And then number two, you link how substance use interferes or harms that behavior and those outcomes. Let me give you one example of it. Here's a two-step process. Step number one, here's the positive images, here's the positive benefits. The focus here is on regular physical activity. So quote, young people who engage in regular physical activity tend to feel energetic, sleep better, and look more active, fit, and confident. So the underlying images are cue, again, those desired future images that young people have of themselves. Who doesn't want to be more energetic, active, fit, and confident? That increases motivation for change. Another benefit listed, but that wasn't image related, was sleep better. So a lot of content in this, and you do know what the focus is. Young people is the focus, and regular physical activity. Step number one, highlighting those benefits and those positive images. Step number two, now we're going to link how substance use is a barrier. Marijuana use reduces your energy level needed to participate in regular exercise and achieve your fitness goals of being in shape, looking good, feeling fit and active. So here, very simple process. You're now linking how marijuana is a barrier. Marijuana harms being regularly physically active and achieving those positive images and other benefits. That's this two-step messaging process you'll see in Prevention Plus Wellness programs. Now let's take a look at PPW and how it promotes habits that improve both mental and physical health. So how does that happen? Well, Prevention Plus Wellness programs, like other substance use programs, do address these very important substances that are prevalent among young people. These are actually data from the Youth Risk Behavior Survey Study, annual survey. They haven't changed that much in the past several years, past couple of years. And what you're going to see is that, and this is the percentage of ever use. You'll see that high school students, the majority of them, 6 out of 10, have used sometime in their life alcohol. That's followed by e-cigarettes, and that's followed by marijuana and cigarettes and opioids. So Prevention Plus Wellness programs do address those substances specifically and indirectly. Either both directly to like a vaping PPW program, opioid PPW program, but also just in the messaging indirectly as well. And then also, these are the chronic disease risk behaviors, and the majority of these are addressed, I should say, in Prevention Plus Wellness programs. And you can see some of the most prevalent ones, starting with 3 out of 4 youth not getting 8 hours of sleep, not getting 1 hour of physical activity 7 days a week. That's followed by 2 out of 3 not eating a healthy breakfast every day of the week, only less than 14% eating even 3 vegetables a day. And of course, we see the numbers of hours of screen time increasing during the pandemic. So these are the chronic disease risks that are also addressed. So, and so you've got these substance use and chronic disease risks, and these address and improve mental and physical health of youth. There was a review, a seminal review by Fox and colleagues in 2010 that showed over half of US adolescents engage in 2 or more co-occurring health risks. And that's why these researchers recommended interventions at the clinical and community levels that target more than just one risk, more than just, like, say, substance use, but other health risk factors among young people. I would say that's essential for schools as well. And these authors recommended that the interrelatedness of health risk behaviors should be addressed and taught to young people. In other words, how does substance use interfere with wellness behaviors, and wellness behaviors help protect against substance use? There was a more recent study done in 2016. Multiple health risk behaviors were found to be common among American adolescents. That was by DeWinter and others. They showed that less than 4.2% met all 8 health behavior guidelines. And in fact, over 10% had 5 or more risk behaviors at age 16. We could assume that increased over to age 18 and 21. In addition, this research found that not eating fruit, vegetables, and breakfast, overweight and obesity, physical inactivity, and smoking all protected other future health risk behaviors. So these researchers recommended prevention that targets, again, multiple risk behaviors. They said multiple risk behavior interventions are needed. You need some more proof to that. Research shows that there are benefits to a healthy lifestyle. Healthy lifestyle being one where you're physically active, eat nutritiously, get plenty of sleep. Research shows that healthy lifestyle is associated with less depression, anxiety, unsafe sex, and less alcohol, tobacco, and illicit drug use. This is relevant and I would say critical to all of us in the prevention field. Also, healthy lifestyle was found to improve physical and mental health and self-reported quality of life, more positive self-image, self-esteem, right, self-regulation, confidence, and life skills, greater brain development, cognitive functioning, more socializing and friends. A healthy lifestyle was associated with greater academic success as measured by less suspensions in schools, greater attendance, less dropouts, and more likelihood to attend and complete college. Lastly, of course, a healthy lifestyle, as you would imagine, associated with less chronic diseases, including heart disease, diabetes, cancer, stroke, obesity, and even osteoporosis. Now, what's the evidence for the effectiveness of multiple risk behavior programs? So here you see a summary of 2 reviews of research. Again, I love these reviews because it's not just a single study, but it's multiple studies looked at together. So there was a review in 2014 that concluded that integrated prevention programs are feasible and may be more effective than discrete, or in other words, focused single session, or I should say single risk behavior interventions. Then there was a review in 2018 which showed that universal school-based interventions that address multiple risk behaviors rather than single risk behaviors were found to be helpful in preventing tobacco, alcohol, illicit drug use, antisocial behavior, and improving physical activity. Lastly, there was a review also in 2018 which showed that decreased adolescent substance use was associated with one-time single session, but also other multi-health consultations and I should say one-time multi-health consultations as well as group sessions, and school-based interventions targeting multiple health behaviors can be effective and efficient way to decrease youth substance use. Okay, so plenty of evidence in reviews of research showing the benefits of addressing multiple risk behaviors in single interventions. Now let's look at PPW programs implementation issues. PPW programs, that's prevention plus wellness programs, are scripted. What are the pros to scripting? That's the left-hand column. It makes implementation easier. It reduces training time. It increases fidelity and reliability. That means that if I implement it or you implement it, or we implement it today or next year or 5 years from now, if we follow this script, it's the same program. So that's the beauty of the scripted program. And scripting the program allows less skilled implementers. So you really don't have to have a background or specialized training. In fact, we even train youth to implement prevention plus wellness programs under our youth leadership training to implement PPW programs to their same or younger age peers. The downsides or the cons to having a scripted program requires practice. You have to practice your script. It does feel initially, for some people at least, a little unnatural till you practice it, and you do have to have your script to implement your program. I mentioned this earlier. We have our prevention plus wellness programs implemented in all 50 states and internationally, and just about any setting, because of their brevity, because they focus on positive behaviors, they integrate with the wellness behaviors, because they're a single purchase, because we have brief 2-hour online training. All of these things are the reason why prevention plus wellness programs are being implemented in all these different settings and just about anywhere where there's youth or young adults. In school, health, PE, lunch, you can go down the list there. Sports, physical exam settings, juvenile justice, homes, colleges, military, et cetera, et cetera. You have 3 options for implementation, 3 decisions to make. Do you want to implement prevention plus wellness programs as a standalone program? Or like most organizations I've seen across the country, they have other prevention programs, other opportunities for young people to engage in physical activity, sports, healthy nutrition, sleep. And that's a great integrated program, because then your prevention plus wellness program could I think, support other programs, whether those are prevention or fitness or education or whatever. Secondly, you can implement your program to youth individually, one-on-one, or in a group, that's 2 or more. Thirdly, you can implement your program in person, or you can implement it remotely. So those are some options that you have, very, very flexible implementation options for prevention plus wellness programs. Over the years, PBW programs have been adopted and adapted and modified. Over the years, for example, we've gone from the development of the sport and InShape prevention plus wellness programs focusing on alcohol to programs that focus on vaping, e-cigarettes, marijuana, opioid use. Of course, our In God's Image, faith-based programs, Sport 2, racial justice. So the content has emerged over time. Our programs originally designed for universal prevention intervention for all youth, now being used throughout the country and abroad as for high-risk youth, like substance using youth or youth with behavioral problems, juvenile justice, whatever the case may be. In other words, they're being used as selective and indicated interventions. Originally, our programs were for high school, middle school. Now we have programs for children. We have programs for young adults. We train youth to implement programs to their peers. Programs now being used in just about all these different settings. Originally, they were being used in schools, as you might imagine, but now recreation and sports, wilderness, juvenile justice, again, just about anywhere. U.S. military. We now have more content for you to follow up if you want to expand beyond a single session. We have free resources on our website, web-based resources and other content. We have a translation in language. Certainly our Turkish sport program was translated. And obviously we now have online protocols. Training opportunities, there's 3 of them. We have the 3 primary ones. We have got a 2-hour online program implementer training. We've got a 2-hour online train the trainers in case you want to train other program implementers in your organization, in your region. We have a 1-hour youth leadership training to help youth implement a prevention plus wellness program to their peers. As far as evaluation services go, we include scannable, a pre and post test. This allows you to assess the immediate effects. What are the targeted effects of your program for your youth? You as an instructor, you and your organization. This includes 2 critical predictive measures of multiple health behaviors. The measures are behavioral intentions and perceived harmfulness. The substance use measures, there are 5 of them. Alcohol, in most of our programs, alcohol, tobacco, marijuana, e-cigarettes, and illegal drugs, as well as 4 protective behaviors: physical activity, nutrition, sleep, and stress control. We provide a free analysis of your scanned surveys. It's called the Prevention Plus Wellness Behavior Report Card. And we also now have optional pre-post online surveys, links to online surveys, as well as to an instructor survey. So if you do implement Prevention Plus Wellness programs online, you could simply use our online pre-post surveys and even the instructor survey to evaluate your program. Very convenient, no data collected. It's really, really an awesome thing. Concluding, 4 things. Number 1, prevention plus wellness programs address alcohol, e-cigarettes, marijuana, opioids, other substance use with chronic disease risk behaviors and other substance use risk factors. Secondly, numerous differences exist between typical substance use prevention programs and prevention plus wellness programs, which really highlight the advantages of PPW programs. Thirdly, theory, research, and practice supports the use of brief as well as integrated multi-health risk behavior interventions for preventing youth substance use and promoting wellness behaviors. And lastly, number 4, PPW programs have been adapted to address different and emerging substance use risk behaviors like vaping and marijuana, opioids, as well as other levels of prevention, universal selective indicated, different populations, settings, implementers, languages, and online use. Now, you can learn more, and we do have a whole bunch of free resources on our website, preventionpluswellness.com. Go to the tools header and you'll see all kinds of free resources for you, regardless of whether you're interested in implementing any of our programs or can afford to do so. We have free resources on our website. You can learn more about our most popular programs on our online catalog. You could request a sample of any of our programs, electronic sample. I'll be sending you a PDF of these slides for those of you on here live, and so you'll be able to request again a sample of a program if you want. And if you just leave your email address, and you'll be on the listing for our weekly notifications for free webinars and resources we offer at Prevention Plus Wellness. You can reach us here, preventionpluswellness.com. Our phone number here, beautiful St. Augustine, Florida, is 904-472-5022. And again, our email address is info@preventionpluswellness.com. All right, thank you so much. Let me stop at this point and let me field some questions that people may have. For those of you who are listening on this recorded session, you could email us your questions at info@preventionpluswellness.com.